Solidarity forever. Solidarity forever. Solidarity forever. For the union makes us strong.
We are running out of drugs in this county. The county government of Bungoma allocated 8 million for the whole county to buy drugs. That one cannot buy even drugs for the county for 1 month. For this financial year, we have already spent everything in terms of allocation for non-farms and pharmaceuticals. So which means from January to July, there are no drugs in our facilities. We are forced to tell patients to go and buy drugs. This is the county that they are in. These are the government that we voted for. They must take care of our patients, and they must take care of our health through buying of drugs and necessary supplies for us to work. So we cannot sit in the hospital, see patients suffer with no drugs. Let the county government come out clearly and tell the public which type of drugs, when did they last buy, or when did they last supply the hospitals with the drugs. So these nurses you see here, they are straining to convince these patients to go outside and buy drugs. When they bring us Panadol, the following day they are on media, ya kwamba tumesupply madawa Bungoma. Bungoma county hospitals across the county, they are not having drugs. So we want, come in level 3 hospital, we want those drugs that are supposed to be in level 3 hospital to be there. Nurses of Bungoma County, they offer health services to the citizens of Bungoma County. It is unfortunate that the same nurses who are offering the same services, when they are in need of these services, they cannot get them. Reason being, they are not having the cover to treat them. When you look at the outline of SHA, we are not opposing the government policy, but the way it is structured, a nurse on duty in level 5 hospital cannot receive treatment from the same hospital when he or she falls sick. He is supposed to send back, leave the patients and go back to the dispensary in the rurals so that I were referred from that area. Our colleagues have gone to school. They have specialized in different areas. But when they come, some of them have been in that former job group for 10 years without resignations, despite going to school. So we want the county government, through the Ministry of Health, to redesignate all nurses who are due for resignations. This is a demand that we are demanding. We have been talking to you, and you have not been implementing our talks. So we have said, now let us sit back, withdraw our services, so that you listen to us when we are at home, and when you address it, we'll come back. These nurses,
oh yes,
they are dedicated to their work. And the reward of a dedicated person is to appreciate that person through promotions. It is also written in the law, our human resource manuals, our employment acts, our scheme of service, that when a nurse works for a minimum of 3 years, that person qualifies for promotion. These nurses standing here have worked for more than 15 years, 20 years. Since they were employed, they have never been promoted. I'm having one who was employed in 1999 with the national government. Last time of promotion is 2008. Up to now, that person has never been promoted. Miaka inasonga. The age is moving. How are we going to address this issue? The health executive has been moving around, upgrading healthcare facilities from level 2 to level 3, from level 3 to level 4, from level 4 to level 5. As we speak, Bungoma County Referral Hospital is ranked as level 5 hospital, receiving 300 million equitable share. But when it comes to staffing, is wanting. It is doing at staffing of level 3 hospital, how will we offer the services to residents of Bungoma? So we want employment of new nurses. Those who have retired, we want replacement. Those who have been moved out, who have been moving out for greener pastures to other countries, we want replacement. Bungoma County Referral Hospital currently, it needs more than 500 nurses. Yes. But as we speak, we are doing at 180. Not even a quarter of what is required. So these nurses you see that are standing behind me are working under burnouts. They are not delivering 100% what they are supposed to deliver. So we don't want to continue killing our patients. Let us stay at home until the issue of shortage is addressed.
As we've started our strike, let us not relent. I want to urge the people of Bungoma to find services from other facilities, because we as nurses of Bungoma County, we are not going to offer our services until all our demands are met, until all our demands have been they implement all our 10 issues that we've presented today here. We've been having several meetings with the executive, but there is no time we've had any fruitful meetings with them. So we are telling them we are ready for dialogue as usual, but until we implement and until all our demands are met, that's when we are going to tell our soldiers to go back to work. Currently, we are on strike. I want to tell everyone that we are on strike and we shall go back to work until our demands are met.
Naitwa Felicitas kutoka Miruki. Niko na wajukuu wangu wawili mapacha. Saa hii hakuna usaidizi, madaktari wameenda Mgomo. Hakuna chakula, hata saa hii tunalia tu, hata mkikuja tu ndani mkiangalia wamama tuko na shida. Ningependa serikali mtusaidie sisi, kama hamkusaidia tutafanyaje?
Majina zangu naitwa Masi Akiza kutoka Malaba Central. Mimi niko na mtoto hapa ni mgonjwa, na ningeomba serikali iweze kutusaidia, manake tunaumia sana. Mambo kwanza ya SHA, hiyo SHA wameka limit zake ziko juu sana, tunashindwa tufanye aje. Sisi tungeomba serikali itusaidie, tuachilie twende nyumbani. Tena jambo lingine lenye ninaweza sema, wasaidie nurses, walipe nurses, kwa sababu nurses ndio wamekuwa wakitusaidia hapa. Saa hizi watoto wanakufa, tumepotesha watoto 7. Saa hizi kutokea nikuja mahali hapa. Ningeomba tu tafadhali serikali tusaidie, manake hapa ndani tunaumia sana. Wajaribu kulipa wafanyakazi wa mahali hapa.
Kwa majina naitwa Edith Chuma, natoka eneo ya Kibabi. Nikapa na mgonjwa mtoto wangu. Natumia SHA nirejesi, lakini nimeenda kupewa bill nalipa 11,700. Sasa sijui hiyo pesa yenye wanasema yenye iko kwa SHA inatumika nini. Na madaktari vile wameenda kwa Mgomo. Na ukiingia hapo ndani mambo ya afya bana hatuko sawa. Hawakilini. Sasa tu na wakisema ati tuendelee kukaa hapa, watu wenye tumekuwa at least ndio sasa tunaendelea kuwa wagonjwa.
Mimi naitwa Wilfred Osundwa, the organizing secretary wa Kenya National Union of Nurses. Mimi ninakuja tu mbele zenyu kuwahimiza kusema strike iko on, na ninaitisha kila hospitali ama kila zahanati yenye iko Bungoma penye nurses wako wafunge virako, waende kwa nyumba, wakae, watulie, waongoje izile 10 grievances yenye tumeandika, tusikisane, wakubali kulipa, ndio sasa turudi kazini. Lakini hatutaki mtu yote arudi kazini, kwa sababu tumekuwa na hii mchezo yenye imekuwa kwa muda mrefu. Kwa miaka 2 tulikuwa hapo kama tunazungumza hii jambo, na tumezungumza na hatujapata majibu kwa hii jambo. Sasa tukasema kama mfano kama promotion. Promotion walitengeneza promotion ikaenda kwa Tirak. Huko Tirak lazima promotion kama inaenda huko, pesa zinakuanga zimetengwa kando. Lakini wakati ilitoka Tirak ikaenda Kachirak kama pesa imeweka kando, na wakati hizo machina zilifika Public Service Board, hiyo pesa ikapotea. Je, tunauliza hiyo pesa ilienda wapi? Kuna wafanyakazi wengine wenye wamewacha kazi, wenye wamekufa, wenye wameretire, na pesa zao ziko kwa budget. Hatuoni penye hiyo pesa zinaenda, na hizo pesa zinatakana zifanye wafanyakazi. Sasa kwa hivyo tunasema waunguzi wa Bungoma wote, hii ni kupikana kwenyu, hii ni vita zenyu. Msilale wala msifanye chochote, msitishwe hala msifanye chochote. Ninamwambia kuanzia siku ya leo, chinzi tumeanza Mgomo, mkae nyumbani, msiende kwa hospitali. Wacha hospitali zote zifungwe kuanzia level 2 kufika level 5.